delegates, respected members of the university, and all the participants from prestigious colleges across the country with great joy and exaltation. We, the students of University of Calicut, take the privilege to invite you all to this national seminar on the topic Psychological Impact of COVID Pandemic, PsyCoV-22. Now we will move to the inaugural session of the national seminar. We invite Professor Baby Shari for the opening statement.
Good morning, one and all. Honorable Vice Chancellor, Professor M.K. Jayaraj, other distinguished guests on the dais, Syndicate Member Professor Manoharan Sir, our Head of the Department, Dr. Manikandan, IQAC Director, Professor Shivadasan, my dear colleagues, other delegates, and students. Actually, we are undergoing a crisis. The pandemic happens to be just like a sudden shock to the mankind. As we say in psychology, when we talk about different kinds of stress, usually say that stress is something which cannot be managed easily, something which will be affecting our equilibrium and things like that. Some theory says that the situational factors will be affecting us to a great extent, and nothing can be talked about that. Just like when we were facing tsunami and things like that, the situational factors will be affecting, and no other theory will be working on that. In certain other times when we talk about losing a job or having a sudden emergency and all, we can have different kinds of psychological theories and try to explain it. But the pandemic happens to be something extremely new for the mankind. And many a time it was trying to deal with emergencies, especially that was giving importance for medical emergencies, such kinds of health management and things like that. And law and order also was highly being affected, so that sometimes it was a new situation for us that police and other people was trying to control these kinds of emergencies and all. In such a context, we could see that the economy is affected, whole world is getting affected. Our nation was trying to deal with the situation in a different way, and the state management also was very wonderful, so that we thought about how we can go to a government hospital in a very nice manner, and different kinds of treatment was just like, receiving a guest, and how to manage the system and things like that. Voluntary workers also were coming forward. We for the first time thought about community kitchen and things like that. It is in this kind of a context we understood that we cannot move forward like that further. We have to think about different kinds of management, different kinds of dealing with things and things like that. And the academic sector also was a major concern for the society, major concern for the government. And in the university also, we are coming to a different kind of management and things like that. And there comes the importance for dealing with these kinds of things in a social manner, in a psychological manner, and the importance of research and studies and intervention is coming. And it is in this kind of a context we thought about having the title of this conference as the psychological impact of COVID pandemic, especially how that is affecting different arena of life. Okay, so that's about, and the outset I thought about talking about why we came to this kind of a topic. Many kind of studies were conducted even in India in the psychological aspect. Many time that was led by psychiatrists, led by social workers, and psychologists are also being concerned about studies, but much kind of things were done in interventions, the psychological management and all. Even in the university sector also we thought about online support and even direct support, and we received calls from different part of the world itself. Our student team also was leading to support the students community, not limiting to the boundary of the university. Okay, let me come to my duty. When we had planned about our seminar, I thought about a time when we were dealing with these kinds of events. Sometimes my colleagues may be aware of that. We had done programs. We had done programs even national and international level with no administrative support and not even the basic kind of sometimes facilities were not extended to the Department of Psychology. It is in that kind of a context I think about an administrative support and having an academic leader like our Vice Chancellor who was ready to come over here even amongst the midst of many academic and other kinds of management duties. And today, Dr. M.K. Jayaraj was telling that he has very responsible duties of selection and other kinds of things in his office. At the same time, sir was ready to come over here and was also providing all the academic support, and the approach of the Vice Chancellor is found to be student-friendly. And wholeheartedly on behalf of the Department of Psychology and this 3-day national program, I extend a warm welcome to you, sir. The syndicate at this time is unique in many ways. We are facing different kinds of crises, and the management and also the academic support that is provided to the system is quite relevant and noted. And as the representing our syndicate today, the presence of Professor Manoharan is here. Sir is extending felicitation for the program. Wholeheartedly, I extend a warm welcome to you, sir. Now we are at the time of an inspection, especially in terms of NAC. And we know that the whole kind of our activities are actively being organized, managed, and led by our beloved Professor Shivadasan sir. He is heading IQAC. As IQAC director, we could receive his leadership in many ways. And even for this program also, the publicity and other kinds of support is being extended by Professor Shivadasan. On behalf of Department of Psychology and 3-day national seminar, I extend a warm welcome to you, sir. Our beloved head of the department, Professor K. Manigantan, he is there with all kinds of support and leadership for our programs and other kinds of activity. As part of formality and also wholeheartedly, I welcome you, sir, to this event. My dear colleagues, students, research scholars, I know that you were there to work along with us, and you happen to be the backbone of this 3-day program and also all other activities. And especially about my colleagues, I have to see that the young blood happens to be the backbone of this program. And wholeheartedly, I welcome one and all to this function. And the delegates for this particular program, there is about more than 300 delegates already registered to this program. We have esteemed invited speakers as guests who will be joining online and offline. Non-teaching staff has supported to this program to a great extent. Even yesterday, we hadn't sanctioned the formal order, and within 1 hour, the academic system as well as the non-teaching staff was supportive enough to make it out. The technical support is provided by the staff of the university, and also we have some private agencies to support us, the PRO, press, media personals. The participants, especially 2 different groups. A student group is joining us for a symposium to see how far this is affecting the youth life in different ways, especially in terms of academics, research, in their social life, interpersonal relationship, and things like that. So that team is there, and also in a panel discussion, other group is joining. They are talking about how the disability management was affected. We have CDMRP, as you know. That is a community-based disability management and rehabilitation project. And under their leadership also, a team of experts are also joining us. And the staff and students and research scholars of our department and other departments, wholeheartedly, with one word, I welcome each and every one of this group to this academic function. And let us listen to the colorful part of this event. Thank you.
Thank you, ma'am. Next, we invite Professor K. Manikandan, Head of the Department, Department of Psychology, University of Calicut, for the presidential address.
Respected Honorable Vice Chancellor, Jayaraj sir, Syndicate Member Manoharan sir, our IQAC Coordinator Professor Sivadathan sir, my colleagues, my students and participants in the online, and also the invited guests. Actually, as you know that the COVID-19 pandemic has brought many changes to the human community in many ways, as our Professor Sari mentioned. So in the realm of human endeavor, we can see that this pandemic, actually in this century, this is the first experience to the human community. Here, as a psychologist or student of psychology, we have to do a lot of things. If you are going through the literature for the last 2 years, we can see that the scientific community is trying to answer many questions. Even the just beginning of the pandemic, this around during 2020 May, I have gone through an article which describes how the COVID virus is affecting the brain. That means how far this virus is affecting the damage to the brain, as well as how this process of psychology, especially the social psychological behavior of the human beings affects, this COVID affects the social psychological aspects of the human being. So I think during these 3 days, our speakers from various fields, that means it's a multidisciplinary approach. That means that we have experts from social work, medicine, and social sciences are there. So I think they will be moving through the COVID and how it affected our community. So anyway, I'm not talking too much. Anyway, I once again thanks to the all of the participants through online and offline. Thank you very much.
Thank you, sir. Now we invite Dr. Rajni Ramachandran, Assistant Professor, Department of Psychology, University of Calicut, to say a few words regarding the intention behind the seminar.
Good morning, everyone. Honorable Vice Chancellor, Professor Jayaraj, sir, distinguished dignitaries on the stage, Professor Manoharan, Professor Sivadathan, Manikandan sir, Shari ma'am, dear colleagues, friends, students here and online. My duty today is to give a short note behind the intention of conducting this seminar. As you all know, that the one way in which we could describe the world over the last 2 years is something like a world out of a science fiction novel. However, that doesn't come even close to capturing the effect of the pandemic, which has affected all spheres of human experiences. Researchers predict that this effect is going to endure for far longer than the pandemic, 2 years after we all stop masking and social distancing. Let's take something as simple as face perception. Over the first year of life, psychologists know that babies sharpen this innate ability to understand faces by having a huge amount of experience and exposure to lots of different human faces. the babies born over the pandemic would have experiences of masked faces, and in years to come, I can imagine researchers comparing face processing ability of babies born in the early 2020s. If we widen our lens, we will have issues like widening academic gap, isolated adolescents, changing family dynamics, increasing economic disparity, marginalization, so on and so forth. It is obvious that psychologists will have a major role in the years to come. At this crossroad, we need to carefully reflect on whether we grab this opportunity to merely put humankind on the psychologist's couch or as data points in Excel sheets, to confirm theories or to develop new ones. Or should we take this opportunity to rethink our role and work towards a much needed paradigm shift in our profession? We need to think how we want to practice psychology as a professional, as a researcher, as an academician. A much needed foundation for this later, which I think is more important, and everyone who have been involved in this conference also feels, is that we need to hear voices of people, their experiences and their reflections from the pandemic. And it is with this intention that we have organized the seminar, Psychological Impact of COVID Pandemic, as a meeting space for academicians, professionals, entrepreneurs, parents, researchers, students, who bring with them a diversity of perspectives and experiences of the pandemic. It gives me immense pleasure to invite all of you to share this space and this journey with us. Thank you.
Thank you, ma'am. Next, we take the privilege to invite our Honorable Vice Chancellor, Professor M.K. Jayaraj, for the inaugural session.
Good morning, all. Professor Manikandan, President of the function, Dr. Manoharan, Syndicate member, Professor Shivadasan, IQAC coordinator, Dr. Rajni Ramendran, Professor Baby Shari, faculty members, and dear students and participants. At the outset, I congratulate the organizers, especially the psychology department, for choosing a relevant subject which is very relevant today, not only because it's a subject of study for the psychology student, it's a multidisciplinary subject that we have to address. And as an academic community, we have the responsibility to lead the society in a correct path. As all of you know, humanities has been undergoing through an unprecedented calamity. Unprecedented in the sense that this pandemic has affected the whole humanity. Maybe in the previous past, there could have been calamities, but it has not been affected in this scale. It has affected the whole humanity. And in the time of unprecedented challenges, even if you take 70 years back or 50 years back, 1973, there was a study. So in those days, the medium of communication between the student and teacher is the blackboard. And you can see that the study shows that almost 80% of the Kerala schools have good blackboard, whereas in UP, the number of schools which has a blackboard was only 17%. This is true now itself. We have most of the 80% of the student is connected through internet and digital gadgets. But in other parts of India, the connectivity is less than 17%. So in that way, Kerala students are lucky. Still, the COVID pandemic make the students uncertain of their future, make fear of the future, and so on. So I'm glad that the psychology department has come forward to discuss all this problem. and we can have a solution. I understand it's a multidisciplinary seminar, and these discussions and revelations can help the community how to proceed further. I will remember one of the Japanese concept of serving tea, which is called ichigo ichi. It's a concept when you serve the tea, how it has to be served. It shows that you have to enjoy every moment where you are sitting or where you are. So it says that if you are angry, you are living in the past. And if you are in fear, you are living in the future. So if you are living in present, you will be at peace. So I think this conference will give an idea how to live present, and the students to have an idea how to live in peace. So with these words, with all your permission, I declare this seminar inaugurated. Thank you all.
Thank you so much, sir, for your visionary words and sharing your deep thoughts on the topic with us. So, moving further, let's invite Professor Manoharan, the syndicate member of University of Calicut, to deliver the felicitation.
Very good morning to everyone. Respected chair of the session, Professor Manikandan, most respected Vice Chancellor, Professor M.K. Jayaraj, Professor Shivadathan, the IQAC Director, other faculty members of the Department of Psychology, distinguished participants, delegates of the 3-day national seminar, research scholars and students. I'm extremely happy, honored and privileged to be part of this important program. And I would like to express my thanks to the organizers for inviting me to this program. The COVID-19 pandemic has created the largest disruption of education system in history, affecting nearly 1.6 billion learners in more than 190 countries and almost all continents. Closures of schools and colleges and other learning spaces, including our university, have impacted 94% of world's student population, almost 99% in low or low middle income countries. The crisis has been exacerbating pre-existing education disparities through multiple waves of COVID by reducing the opportunities for many of the most vulnerable children, youth, and adults, those living in poor and rural areas, especially girls, refugees, persons with disabilities, and learning losses also threaten to extend beyond this generation and erase decades of good progress. Huge number of students drop out or not having access to education due to the pandemic's economic impact alone. Now, all these collectively contribute to the psychological instability to the mankind. I feel that it requires an urgent action from all to prevent a learning crisis, a living crisis, from becoming a generational catastrophe. I am sure that the 3-day seminar being conducted on psychological impact of COVID pandemic is a need of the time. I would like to congratulate the head of the department and the faculty members of the Department of Psychology and all those brains behind this for organizing this academic fiesta, and I wish the program all the best. I hope the seminar will include expert lectures and talks on issues of critical importance, including drug addiction, mental health, disability management, and disaster management during the pandemic, among other issues, and the programs that are aimed at raising awareness about the social responsibilities of the teachers and students. Of course, I do appreciate the Department of Psychology for organizing this seminar in a professional manner and ensuring quality hospitality for the outstation participants, and for arranging a nice online platform for interaction from all parts of the globe. And also, this department being a very old department, I remember it started in 1973 with a master's MA program under the Faculty of Humanities, and sometime later, I think 2000 or so, 2003 or so, it was converted to the master's MSc program in psychology under the Faculty of Science. And now it comes under the School of Biosciences. So this department has a very good historical and traditional values. And the striking feature I observe with regard to this department is its social extension. That is a kind of a mode they always manifest. So on behalf of the syndicate, as a member of the syndicate, I would like to congratulate the department, and also wish the department all the best, and also in particular for the conduct of this program. Thank you all.
Thank you, sir. As a token of gratitude, our student representatives, BV and Harida, will present our Honorable Vice Chancellor, a sapling. Next, we would like to invite Professor Shivadasan P., Department of History and Director IQAC, to deliver the felicitation.
Respected Professor Manoharan, Member Syndicate, Professor Manikandan, Professor Shari, Professor Rajani, Dr. Ramshida, Dr. Needu, Dr. Kiran, Dr. Lakshmi, other participants of the conference, students, research scholars, and my dear friends. I'm very happy to see that the psychology department is organizing a seminar on the most relevant issue today, COVID and its impact upon the mental health of the people. Actually, this is the responsibility of a university to the society, and the department is undertaking that responsibility to the people, to the community, when the society is facing a severe crisis of the created by the COVID pandemic. When universities began to function in the world in the medieval period, they started their activity with the watchword, enter to learn, exit to serve. All of us, in a wrong way, consider that universities are the factories producing degree certificates, PhD certificates, and postgraduate certificates and other issues. The university has to undertake the responsibility of responding to the challenges faced by the society in time to time. During the outbreak of the COVID pandemic, being a faculty member of the history department, I understand that the severity of this issue which created upon the mental situation of my students. At that time, I utilized the service of Dr. Lakshmi in handling the situation, and she gave a lecture and also an interactive program to my students. Throughout history, which is my discipline, I understand that the mental situation is a determining force in shaping the physical activities of human beings. In 1921, when the Mappala Rebellion took place in Malabar against the British and landlordism, huge number of healthy Mappala people were captured and deported to Andamans. They lived there in isolated cells, the most notorious Andaman prisons, and they were not permitted to come back to their home village to see their brothers and their family members. In 1931, the British government conducted a study about the mental health of the prisoners, freed prisoners in the Andaman Islands. I happened to see this mental health report of the Mappala prisoners and the freed people in Andaman Islands when I did a fellowship program in Indian Institute of Advanced Study in Shimla. That is a very shocking record of the mental health of the prisoners, our own people of Malabar, imprisoned at the Andaman Islands. And throughout history, mentalities is an important issue determining the life and the attitudes, the physical activities, health of the people. Now our university, many departments of our university are undertaking different programs as a response to the challenge of the people facing in the world today. The mental health programs and different activities of the psychology department is very appreciable, and we have to undertake more and more programs to show our responsibility, to fulfill our responsibility to the people living around us. I wish all the programs to this COVID pandemic seminar, and I request all of you to bring out an output, an outcome of this seminar, either in the form of a publication, documentary, or any other way, which may benefit the people to see a solution to the severest issue the humanity is facing today. All the best for the seminar. Thank you very much.
Thank you, sir. Now we invite Dr. Lakshmi, Assistant Professor, Department of Psychology, University of Calicut, for the deliverance of the vote of thanks.
Good morning, everyone. On behalf of Seminar Organizing Committee, I would like to express my sincere gratitude to our Honorable VC for accepting our invitation in spite of his busy schedule and for his constant support and guidance. I also take this opportunity to thank Professor Manoharan, Professor Shivadasan for your kind words. Of course, none of this would have been possible without the support of our beloved head of the department, Professor Manikandan, Professor Baby Shari, and all my dear teachers and colleagues. Also, I would like to thank the administrative staff, the technical support team, and our dear students for organizing this very effectively. I take this opportunity to acknowledge their efforts and to thank each one of you. Thank you so much.
Thank you, ma'am. Now we are going for a break, reminding you all that we'll resume the seminar by 11:15 a.m. for the keynote address delivered by Professor P.K. Shajahan, titled Structures, Contexts, and Intersectionalities, What COVID-19 Informs Mental Health Practice. Structures, Context, and Intersectionalities, what COVID-19 informs mental health practice.
Dr. Shajahan is a full professor of social work and currently Dean, Academic Affairs at the Tata Institute of Social Sciences, Mumbai. He has earlier held offices of Dean of Social Protection and Student Affairs, Chairperson of the Center for Community Organization and Development Practice, and Program Convener of Social Work at TIS. He is currently the Vice President of International Council on Social Welfare and a member of the Board of Directors of International Association of Schools of Social Work. He represents ICSW at the International Task Force on Global Agenda for Social Work and Social Development. He is one of the founding members of the Critical Edge Alliance and is currently engaged in collaborative academic projects with universities in UK, Denmark, Ireland, USA, and Nepal. His areas of research and publications include communities and marginalities, participatory development, social enterprises, people-centered social innovation, diversity and development, social education accountability, social protection and social policies, international social work, and environmental justice. He is the co-editor of an upcoming book on remaking of social work in the new global era by Springer. Please, sir.
Hello. I'm not able to hear anything, so is my audio okay?
Yes, sir, okay.
Because I was not able to hear anything in between.
So can you hear us?
Hello? Yeah, okay. So can I start? Because I'm not able. Yeah, I'll start. Okay, yeah, thank you. Thank you, and a very good morning to everyone for this very, very important and timely national seminar on effects of COVID-19, and particularly in the context of psychosocial impacts of COVID-19. I was not able to hear anything in between. I thought I was waiting for some prompt to come. Since you are able, I'll go ahead. First of all, let me express my very sincere gratitude to Professor Shari Padiyat, Baby Shari, for inviting me to this very, very important seminar. First of all, let me tell you that I'm not an expert in psychology. I'm not a student of psychology. Of course, I have studied psychology in my social work, but I have been working in the areas of community health, community mental health, and engagement in community on a variety of factors, which in a way contributes to a lot of my knowledge, and still I'm learning from my experience of working with communities. So I'm sure that I'm talking to a group of students and faculty and professionals who are expert in psychology and mental health. But I'm going to talk about some of my views and experiences on the topic and some reflections, my own reflections. Pardon me if I am in a way entering into a domain which is not my own basically. However, considering the fact that we have gone through a very troubled phase in our life for the last 2 years, almost 2 years, going through a trouble of dealing with the crisis, managing our own work, our own studies, our own family, and at the same time, some of us being caregivers for people who have been affected both by the health concerns as well as probably sometimes the mental health concerns which arose in our own families and in our circles. So having said that, can I just present? I don't know whether I am having the presentation rights. Let me just try if it works. Are you able to see my screen?
It's a blank screen now.
Okay.
So can you
I
hear
don't know,
me?
somehow I'm not able to see my own screen. But however, I'll go ahead.
Can you hear us, sir?
My screen is visible. Sorry? My screen is visible to you?
Yes, it is.
All right. Okay. Wonderful.
Thank you.
I decided to talk on the structures, contexts, and intersectionalities. The idea of this particular topic was to look at, give an opportunity for us to look at some structural factors contributing to health and mental health, and particularly mental health concerns arising out of COVID-19. This is also a very important phase in our life and our learning, that a whole lot of issues have come to the fore in informing us about how do we see, how do we look at our disciplines, how do we look at education, how do we look at our practice. So in that sense, it's a very interesting dimension. Just to give you some kind of a broader picture, so that the data on the screen is good enough. The reason why I'm putting up this figure, this is exactly yesterday data of yesterday, which is available on WHO site about the situation of COVID pandemic across the world. We are talking about a huge number of people being affected by the COVID-19 across the globe, and the deaths of about 5.7 million people dying out of this across the globe. It's a huge calamity of the sorts, where we are in a way overwhelmed. Our systems are overwhelmed. Our professions are overwhelmed by the kind of impact a tiny microorganism could create across the lives of all of us. While talking about the COVID pandemic, it is very, very important for us to understand that what COVID-19 has done to us. It actually, recently I was looking at, I was writing a paper for a book chapter. We are looking at, particularly my basic profession is social work. So we were editing a book on the new global era, in which how the COVID-19 and probably many things beyond COVID as well might be coming in, and we are seeing a very, very significant change in the way the society is moving, the way our social policies are being looked at, the way our governments are responding to calamities of this sort. So what we have seen in this entire process is that the COVID-19 pandemic has actually attacking the basics of our life and governance and social policies. The very fact that a state like Kerala could manage fairly well, despite the fact that repeated, cycles of, impact of COVID-19, but we have been able to manage fairly well because we had a very, robust public health system in our state. Whereas, the states where, or the regions or countries where the public health system has not been very, very accessible and affordable, we have seen the pandemic wreaking havoc among those communities and societies. People. This also led to a very significant way in which the lives of people have been affected, mainly when you look at the impact it had on its livelihoods of people. I'm very much aware about the fact that I'm talking at a conference of psychology conference, psychology conference, where I'm talking something which is probably much broader, and which I will come to connect these issues to psychology and mental health at a later stage. So when we are having a huge population of about 255 million people losing their full-time job, and people who have lost their part-time job and informal sector jobs, this is not being considered at all. Given the fact that a country like India is having almost 90% of the workforce are in informal sector, we have no idea about how much is the loss of livelihood and employment for these people. But we are talking about 255 million full-time jobs being lost across the globe, and 3.7 trillion in wages. This is the kind of impact it is having on the people across the world. A study by Asim Premji University in 2021, last year, it talked about 230 million people in India were pushed to poverty just because of the COVID situations. The reason is that they have lost their job, they have lost the opportunity to probably work. When I was talking about 90% of the workforce in informal sector, I'm talking about people who cannot work from home. There was large number of people in the formal sector could convert immediately into a work from home kind of an environment, where informal sector workers cannot just do that, and because if they are not able to go for work, their livelihood is completely lost, and we have no count of those data. It also affects, there is a talk about COVID-19 being a leveler. It affects everyone. It affects almost everyone, be it rich or poor, everyone is being affected. But it is a fact that COVID-19 had a very, very detrimental impact on the most marginalized and vulnerable sections of the society. People who are living in poverty, people who are older, people who are having, probably comorbidities, people with disabilities, youths, Dalits, minorities, indigenous peoples, name any segment of the society which is so-called marginalized. They are differentially affected by the COVID-19 pandemic. And when you look at the impact, it's hugely and disproportionately borne by the poor. When I talked about the informal sector workers, we know that informal sector workers are predominantly the poor and the most marginalized. In my class, I quite often ask, who are these people who are poor in our slum communities? Who are just those who are not having adequate income? If you look at the poverty. And I used to tell my students and send my students to the communities and find out their background, their socio-demographic profile and things like that. They come back and say that a large number of the poor whom we are talking about, who are living in slums and very, very uninhabitable housing conditions in a city like Mumbai, most of them are either Dalits or other marginalized communities. So poor are not just poor because they don't have the income. They also have a socio-demographic profile, which is coinciding with the other marginalities which we talk about. So it's a poor, but at the same time, it's also a certain section of the society which is bearing the brunt of any calamities like this. We talk about washing our hands. We talk about sanitization and things like that. How do people who live in slum communities or poor settlements, who do not have running water, who cannot afford sanitizers, who cannot afford daily changing masks and all other equipments which we consider as something which is becoming part of our daily lives? How do people keep those aspects of security and hygiene? We have seen the impact of COVID-19 among the people who are migrant workers, and we have seen horrendous stories of people walking kilometers to reach their homes and some dying on the way. So this is a huge calamity of sorts. So we need to understand that what we are talking about as a calamity, which is a public health issue, is going beyond the health and well-being of people, but it is touching what I have talked about at the beginning as attacking the core of the society. So what we see over a period of time is that this COVID-19 pandemic, that's what we were looking at in the book, which I was mentioning about social work in the changing global era. We were trying to look at this, the long-term as well as the medium-term impact of COVID-19, leaving behind in the society, where the inequality which exists in the society is going to be, growing in multiple folds. So the existing inequality, the existing social exclusion and discrimination, and global unemployment, when I'm talking about so many number of people losing their employment, 240 million within India itself losing their employment and being pushed to poverty. This is going to leave a huge impact in the society. And we need to realize that what we are seeing today is only a tip of the iceberg. Probably we are not realizing the kind of impact this is going to leave behind. And for professionals like in mental health professionals and students of psychology, we are going to have impact of this coming into our lives and professions and practice in different ways in the days to come. So just to give you how this inequality, since I talked about inequality, it's also very important for us to look at how this inequality gets translated and produced and reproduced in various ways. The chart which you could see on the screen is a chart of COVID vaccination. I'm just talking about vaccination. We are lucky to have a large number of adult population. More than 67% of the people in the country is being at least vaccinated with one single dose. But if you look at the inequality, which is pre-existing inequality in the world, you could see the graph on the right side of the screen, where the low income countries, the vaccination rate is so low that they are being subjected to further new variants, as well as new surge of infections and things like that. At the same time, if you look at the high income countries and upper middle income countries, the vaccination have gone even to 180 million people being vaccinated. So the rate, the 180 vaccinations per 100 people. That means more than 80% of the people are being double vaccinated. Whereas if you look at the low income countries, it is still lying at out of 100, less than 16, 17, people are being vaccinated even with one single dose. So this is a kind of, inequality which exists in the society, which gets translated into vaccinations as well. If you look at the next slide, how much is the vaccine access people have? The reason why I'm talking about vaccine is something which we talk about as something which is going to give protection for all of us to be protected from the virus. Or on the left side of the screen, you could see that high-income countries, 67.92% of the people have been vaccinated with at least one dose by February 2nd, 2022. That means they are all well protected. I've been having collaborations with universities in Denmark and in Northern Ireland, where we were talking about, they were talking about third dose of vaccine, which is almost covering everyone in Sweden and in Denmark and Switzerland. So third dose of vaccine, the booster dose, is almost covering everyone. And all high-income countries put together, 67.92% of the people are being vaccinated. Whereas if you look at the figure for low-income countries, it is just touching 12%. 12% of the people are being vaccinated. So you have a huge population which is unvaccinated and exposed to further variants. And it's not only the health impact or psychosocial impact of it is having. When you're infected, you're not able to work. Your countries will go for lockdown. And when the lockdown gets extended, only people who can afford to work from home will get employment and will get incomes. Others will not be able to get the income from it. And going one step ahead, what is the additional investment the countries will have to make for full vaccination? High-income countries just need to increase their health expenditure by just 0.8%. Just 0.8%, if they increase the health expenditure, they can fully vaccinate everyone. Full vaccination means almost 70% of the people is what globally is being accepted. So just 0.8% of their budget need to be increased to ensure that their people are fully vaccinated. When you look at the low-income countries, you need to increase the healthcare expenditure by 56.6%. You can imagine the kind of disparities which can come out of this process. So there is already the low-income countries are all having low GDP. Then you are expected to make much more provision for more and more more and more budgetary allocations for vaccination. So you need to increase your healthcare expenditure by 56.6%. So the reason why I'm talking about this is all of this is going to have a huge impact in the lives of people. I'll take another small example in Kashmir. I have been working in Kashmir for some time on various issues, and particularly working on community engagements and things like that. So I've been engaging with quite a few people, and I recently had a scholar who completed her PhD in understanding women in conflict, how the women are being subjected to varied forms of violence within the homes, within the society, within the overall socio-political scenario there. So I was interacting with a few people, and some of the reports which came to me tells me that the people have seen almost 20% increase in mental illness within the few weeks of the lockdown in 2020. And a psychiatric practitioner in Srinagar says that in place of 20 people a day, he sees more than 100 people. And you need to understand the context in which I'm talking about, the reason why Kashmir is being talked about. About 45% of the Kashmir's adult population suffers from some form of mental health concerns. What are we talking about? We are talking about a society which is completely, over a very long period of time in conflicts. And the normalcy, so to say, when we say that the Kashmir is coming back to normal and things like that, but the normalcy in their daily lives is not something which they can see. They cannot go, probably send the children to the school without thinking about some untoward incidents happening, or some stone pelting happening, and some action happening from the security forces as well, or some militants attacking some people as well. So all of these things, is someone saying something about something? All right. Okay. So what I'm trying to talk about is that I talked about economic disparities. I talked about social dimensions where Dalits, minorities, and various other communities are getting marginalized during this COVID-19 context. And in a conflict situation, when there is a pre-existing condition of conflict which creates a whole lot of marginalities for people, the mental health concerns are also rising. So are we really understanding the magnitude of problem which is going to come in front of us? And probably maybe I'm sure being psychology scholars and students, you would have better understanding about how many people who are actually having mental health concerns approach for some kind of a support. Very, very minuscule section of the people are actually reaching out to for mental health support in clinics and in various other community settings and things like that. So we have a problem where the huge public health crisis created out of COVID-19 is leading us to unemployment, leading us to huge economic crisis, leading us to policy paralysis, leading us to a huge mental health concern coming in front of us. When we are seeing this, I was trying to look at some studies from India where we can actually see some of such, data could come in. I couldn't get hold of very interesting data from India, but I could get some study from US where the average share of adults reporting. So this is a study by KFF Foundation, which is a non-profit organization working in US, particularly working in the health sector and ensuring that for justice for the people who are denied of rights and things like that. So they did a kind of a household pulse survey, as they call it. When they were looking at the average share of adults reporting symptoms of anxiety disorder or depressive disorder, they compared it with Jan to June 2019 and January 2021. They look at from a jump of from 11% of adult population having some form of anxiety disorder, it has jumped to 41%. Huge increase in adult population having mental health, any form of reporting any symptoms of mental health disorder. There could be a lot of unreporting as well, because some people might not even be knowing that they have a mental health concern. The second slide on this is about the share of adults reporting symptoms of anxiety or depressive disorder during the pandemic, where the kind of disorders, symptoms of anxiety disorder, 35.8%, 28.4% having depressive disorder, and 41.1%, which I showed you earlier, is both combination of anxiety and depressive disorders. This is a huge kind of an impact. If we are able to do similar kind of a survey and look at within our own families, how our children, how our elderly who are in our homes not being able to move around has been affected by it. Maybe we may not realize the kind of impact it is having, but there is significant impact on the mental well-being of people within our own homes and neighborhoods. I'm just getting into a little more, closer linkage with what I was talking about inequality earlier. Share of adults reporting symptoms of anxiety and depressive disorders by household job loss status. We could see that the data very clearly say that families where there has been a job loss, the same kind of disorders were 53.4%, whereas where there was no job loss, it was 31.8%. The reason why I'm saying this is that the linkage between daily life issues and its impact, probably the impact of COVID-19 has been probably similar, or the infections and the clinical factors related to infections might have been more or the same for both these set of households. I don't see any reason to have a different issue here. But at the same time, where people who have lost jobs have had much higher incidence of symptoms of different mental health concerns compared to people families did not have job loss. If you look at the children, household with children under the age of 18 who report symptoms of anxiety, within the household where there are children, families with children below the age of 18, the reason for this particular variables of having children below age 18 is particularly to look at how women get more and more enmeshed in caring duties or taking care of the children, particularly when the children are not able to go to the schools, right? So then the women take the brunt of caregiving, at the same time looking after the household's matters, most of them probably working as well, taking care of their work and things like that. You just imagine the teachers, the teachers who have been school teachers who had to manage their household, take care of the people who are infected at their home, and at the same time teach, and coming onto the screen and teach, with probably a large number of them might not have necessary kind of facilities at their home to maybe teaching. So the reason why I'm saying it is that women, out of the compared to men, women had larger share of such mental health concerns during this period of time. So I talked about job loss, I talked about women, I talked about probably generally about pre and post COVID kind of situations, how the mental health concerns comes up. Now this is a very interesting data. I wish we could prepare similar kind of a study in India where we could look at different ethnic and identity groups. This particular data is very interesting. The dark bar at the middle, all adults, when it is 42.2% of the people, there is slight difference. Earlier it was mentioned about 41 point. I think there are some data kind of representation. But the study which talks about across all adults, when it is 42.4% of the people were reported to have mental health concerns. Among the, if you know the American society, the Hispanics, the Latinos, and the African Americans are the most marginalized, most vulnerable groups for any kind of issue which you talk about. So when it is among all communities, it is 42.4%. Hispanic, or the Mexicans as we call it, or the Latin Americans, it was slightly more than the general data, which is 46.3%. Non-Hispanic Black, which is African American community, which is 48%, and other communities, non-Hispanic, but probably other identities which are not white Americans, it is 48.9%. So you could see that compared to the white population, which is 40.9%, and Asian, do not know why the Asians have lesser. But one thing which I could read from various reports is that Asians are still having a family structure to support. So the family is a little more stronger among a large number of Asian population, even still in US. So that could be one of the reasons. I do not know. I'm just making a guess, like any common man, common person. So the reason why I'm saying this is that different ethnic groups, why do people of different ethnicities experience mental health concerns? What are the reasons for such, what makes them more vulnerable? Because when there is existing socio-economic and political marginalization which exists in the society, which contributes to some level of anxieties and fear and all those kind of factors which could contribute to mental health concerns. When it is having a superimposing impact of the COVID-19, the impact leading to mental health concerns could be much more stronger among these populations. So all of these things, the reason why I'm talking about is that our mental health perspectives on mental health, is it giving us an impression that these issues which I talked about, linking with job loss, linking with identities, linking with gender, can all these be probably addressed by the existing perspectives we have on mental health? Be different perspectives. I told you that I'm not an expert or a scholar on mental health or psychology, but in my understanding, some of the very, very important perspectives which we use or theoretical approaches which we use are there on the screen, whether it is cognitive, psychodynamic, behaviorist, evolutionary, or humanist, or even biological, which even goes to biomedical models which are predominantly used in mental health practice. Are these giving a necessary idea as to how do we deal with this kind of a crisis which you're talking about, which is spiraling into issues getting pronounced for certain communities which are severely marginalized or pre-existing marginalities exist? Is it good enough for us to look at the existing theoretical frames which could probably give us some leads, or is it that we need to go beyond some of these perspectives? I'm again apologizing that you may have maybe different theoretical models which you will be using, which I'm not on a regular basis updating myself, but the basic perspectives which I am talking about is put up on the screen. Now, what is needed in this kind of a phenomenon is that we need to understand what are the socio-political factors which contribute to exacerbated mental health concerns in situations like COVID-19 pandemic. We actually need to situate the mental health within the people's lives. Within the people's lives doesn't necessarily mean that the person who is affected by mental health concern need to probably look at behavioral change, or maybe providing necessary support and social support and all those kind of stuff support. Is it sufficient enough to look at reducing vulnerability to mental health in the context in which I am talking about the larger socio-political dimensions? How the larger systems of power impact the experience of people with mental health? Why people of marginalized backgrounds get disproportionately impacted by mental health concerns? I've shown you the data. I'm not talking about just some assumptions. I'm talking about on the basis of the data which I have presented before you. There are factors where, sorry for the typo error there, the greater exposure to stressful events, poor social support, and policy gaps could be the reason why people of marginalized communities facing severe or much larger impact of mental health issues coming onto them could be because of there is already a stressful event. People who are vulnerable with their jobs or the insecure jobs, they're already under stress. Am I going to get a job tomorrow? Am I going to get my livelihood tomorrow? Is it going to be supported? If I'm having a sick person in my family, how am I going to take care of that person? There is already a stressor within that individual. When it goes to a situation of a stressful kind of event like COVID-19, they will immediately be, probably have much more impact of this in their mental well-being. Similarly, there are policy gaps. They will also have poor social support. When I talk about policy gap, the reason is that when there is people who are working in, unorganized sector, jobs, all of a sudden they have lost a job. They don't have any income. Whereas people in the informal sector, they either, at least even in the private sector, at the most, some companies would have paid half the salary. At least they got something to feed their family. Whereas the people who are in the unorganized sector, absolutely no. So there is no policy support. When there exists a policy gap in dealing with such kind of systemic issues, it will have a larger impact on the mental health, mental well-being of people. So these systemic oppressions where mental health provision is also having a systemic kind of a oppression, I would say, in the sense that people who are what kind of mental health provisions. There are quite a lot of people who have started community mental health initiatives, telephonic counseling and things like that, but still large number of people who are poor and marginalized could not access these services. It's not culturally quite okay for them to, okay, I have a problem, I'll pick up my phone and talk to the counselor. It doesn't work like that. In certain cultures, it doesn't work. Whereas people who are educated, who are connected, if they have a problem in their own family during the COVID-19, we will probably, after probably quite a lot of thinking, but at the same time, you will try and seek the support. Or you can pick up the call and talk in privacy. So you can do that, but that's not possible. So the service provision is also, in a way, is skewed for people who are already marginalized. So what are we talking about? We are talking about the roots of the determinants of mental health, which is not necessarily lie within the therapy rooms, or for that matter, the kind of control trials which we do as part of our theory building as well as practice sessions. We do a whole lot of trials to arrive at a practice model. But much of the determinants of mental health lie outside these scenarios, because there are predisposing factors, which are probably some of these things we will use in ecological models and all. But at the same time, there are a whole lot of factors which lie outside many of these, what you call the dominant paradigms which we use. Just to give you a kind of an idea, I'm just trying to link between poverty, homelessness, and mental health. Poverty is in a way is a significant factor for homelessness. There is no dispute on this, because a large any system to fall back on, they end up on the streets. And if you look at them, they come from extremely vulnerable backgrounds, and that's how they become homeless. So the poverty is a trigger factor for homelessness. Now, if you look at the homelessness can also lead to mental health. If people are being exposed to, continuous exposure to violence and unemployment, people who are on the streets, they are being, harassed by the police. They are being harassed by, the people who are resource rich people. So they find them, probably an eyesore in the society. So a whole lot of violence, covert and overt violence happens to them. And they also do not have necessary income or employment. So that leads to a mental health concern when those factors contribute to mental health concerns. So a large number of people who are on the streets are also having a significant mental health issue. On the other way around, people who are having mental health also, quite a few of them get dumped by their families because they could not take care of them. They end up on the streets. So the cycle of poverty, homelessness, mental health is a vicious cycle where the lack of access to education, healthcare, exposure to violence, unemployment, stress and uncertainty and anxiety, all of these things are contributing to something called a impact of a multi-dimensional poverty which people face, which contributes to mental health concerns in the society. So we cannot just look at, the point I'm trying to emphasize here is that we cannot just look at mental health as something which is inherent within an individual, and you can find solutions with an individual. Probably with, we talk about in ecological models, we talk about environment modification and all those kind of things which we talk about. But despite that, it is not sufficient for us to understand in the magnitude of the problem, which is lying outside the individual, which are beyond the control of that individual. So what essentially we need is an intersectionality frame. That's what I wanted to look at, the structure, context, and intersectionality. Those who are in gender studies would very well know what do we mean by intersectionality. We talk about intersection of various factors of oppression and marginalities. If there is a Dalit woman who is unemployed or who is in the informal sector, she's a Dalit, she's having poor income, she's a woman. So these multiple layers of marginalities operate together. So if you look at the case of homeless people I was talking about, homeless women are much more vulnerable to gender-based violence. There is no dispute on this. And that could lead to depression, anxiety, and stigma and shame, because women, probably homeless because of mental health issues, they become vulnerable to gender-based violence, they become traumatized, stigmatized, and getting into much more complex mental health issues is extremely high likelihood exists there. And just again looking at some data which I could pull out from different reports and publications, is that 5 out of 6 multidimensionally poor in India belongs to Dalit, Adivasis, and OBCs. So it's a huge number. That's why I was earlier talking about, I used to ask my students, who are these poor? Are these poor just because they don't have income? No, they have a social background. They have an identity background. And that identity background is much often, we will see that it is overlapping. So the Dalits, Adivasis, and OBCs, which is, 5 out of 6 means 83%. But the total population, if you look at the all India level, is less than 50%. The Dalits, Adivasis, and OBCs together will be only 50%. But 83% of them are multidimensionally poor. So these factors of inequality gets translated into the poverty, the way it gets translated into the poverty conditions. And 1/3 of the homeless are Dalits. What is the Dalit population? It's only around 16%. If 1/3 of the homeless people are Dalits, that means about 33% of the people homeless are Dalits. Doesn't it talk something about the structural issues which exist in the society, which produce and reproduce marginalities over a period of time? And you look at the trans persons with mental health issues, and those who are working in mental health field very well know that the trans persons, LGBTQIA community, they face a significant issue of mental health. Almost everyone having alternate gender and sexualities are facing some form or the other of mental health concerns. So we need a kind of a frame which will help us to understand the intersectionality of marginalities which exist, which produce and reproduce marginalities, and thereby leading to mental health concerns. So I'll come to, maybe this is probably objectionable for some of you who are in mental health field as well as in the psychology, but I would consider as a kind of a chance for us to introspect. I being from social work, I am also included in this section of professionals who use dominant paradigms. So the manifestation of mental health among people with pre-existing vulnerabilities emanating from socio-economic and political cultural marginalities is something which the dominant paradigm is not able to understand. So the mostly what, quite often in mental health and psychology and all, cultural competencies are being talked about. You need to be culturally sensitive. If there are certain sections of people who follow certain kind of faith, they may have, say for example, you might have read about the hijab issue in Karnataka, right? So we, when we are talking about engaging with those kind of communities, we said, oh, we be culturally sensitive, we be a little more sensitive to cultural practice and all. That's the maximum we talk about in adjusting our practice and knowledge and expertise in this. but the significant issue emanating from socio-economic and politico-cultural factors remain quite often within the dominant paradigm. It remains outside of the bounds. There is an institutional reproduction of structural inequities. How this is happening? Through educators. Now, there are some reports which I was reading that a trans person who is a student of psychology is being continuously bullied by fellow students because of his sexuality, and asking about uncomfortable questions about the private life. So, and teachers also not being able to accommodate and understand this. And there are reports which talks about, mental health professionals who are not comfortable in referring a client to a trans mental health professional, a professional who is, probably belong to, transgender community. What ultimately happens is that the mental health professionals among those transgender communities, they end up having clients from their own community and nobody else. So these are institutional reproduction of structural inequities which exist in the society. So I talked about socioeconomic and institutional exclusion, which I'm not going to get into that. The fourth point which I want to emphasize, I once again apologize to all of you that I'm severely criticizing the approaches which quite often we take, including social work profession I belong to. We emphasize pro-social skills. The pro-social skills means that if there is a child who is depressed, we need to have some conditions where he can interact more and more with children. So their social skills are being developed. So thereby the child will be in a better position to handle the mental health issues in a big way. So it is actually a kind of a hegemonic miseducation which happens, that pro-social skills is also in a way supporting the meritocratic approach which exists in education system. So we feel that the person who is probably less interactive in the class could be because of the kind of inferiority that person is facing because of poor economic financial conditions within the family, or having a abusive father in the at home. How much ever you try to make pro-social skills develop in that person, it is not going to change the situation which lies within the family. An abusive father, almost every day beating this child's mother, seeing everything happening within the close confines of the home. Can the pro-social skill approach help that child to come out of the problem which they are facing? I'm not saying that this, mental health professionals must go to take up such political activism and things like that. I'm not saying that. Another dimension which I'm trying to look at is the developmental psychology, which underscore ableism in the sense that you look at various developmental phases and what are the milestones you need to achieve. And if you don't achieve that milestone, the child is, probably developmentally, disabled, or whatever you call it. But if we undertake developmental psychology courses and we teach developmental psychology to students without having necessary inputs on the context and needs of differently abled, it creates a situation saying that there is something which is desirable, which doesn't exist, and thereby they are disabled or mentally challenged, or whatever you call it, but without having a clear understanding of how do we consider them as differently abled, the very idea of differently abled. If that is not being transacted alongside developmental psychology understanding, it can lead to a kind of a different kind of a understanding of the issue itself. So finally, what I'm trying to look at is that beyond cultural competency, you also need to have a structural competency among professionals and educators. That's something which is very much essential to have. Beyond cultural competency, you need to have a structural competency to understand the structural determinants of well-being. which will be, which will guide us to some way of, understanding it in much more holistic fashion. So I would end my talk with a few questions to all of us, that, while doing all these things, are we becoming a politically disengaged clinician, which looks at, well, that's not my, my area, that's not my understanding, that will, that somebody else will have to take care of. I'm having a client in front of me. I will look at how that person's behavior can be modified, how that person's, problem with self can be addressed, and probably a little bit of engagement with parents and peer and things like that, thereby enabling situation can be created. Are we becoming a politically disengaged clinician? The second question I have to all of us is that, is mental health becoming elitist, caste, class, gender neutral? Are we not really understanding that there is a huge baggage of caste, class, gender issues which contributes to the issues which I've been talking about? Quite often, the argument for being neutral is that being neutral is objective and scientific. But when there is a huge issue lying outside and we do not take cognizance of it, that neutrality is not something which probably is giving us necessary impetus for engaging. The third question is, as professionals and educators, are we enabling individuals to manage their own emotions and behaviors without having an analysis of the contextual factors which I mentioned about? I would like to have no to all these three. Then I think we are in the right direction. If we are able to give no to the three questions, we will be in a better position to place, mental health practice or interventions in psychosocial interventions much more meaningfully in the contextual realities of mental health concerns. The fourth and fifth question which I am asking is, can we use our expertise to challenge institutional and structural violence? When I am saying structural violence, when there is a systemic exclusion of a Dalit, of a minority or a women in work conditions or in any form, or gender-based violence or exclusion of trans persons in work and other spaces, can we use our expertise to challenge some of these things which perpetuate conditions leading to mental health concerns? So if we are able to challenge this, not only in our practice rooms, but also writing something in the newspaper, writing, maybe conducting a study to understand these relationships. If you are able to do, we will be in a better position. And finally, are the ideas of well-being broad enough to accommodate a political project of mental health, which I was talking about? I'm talking about a political project of mental health, where I believe that mental health is political. When I'm saying political, it talks about the need for understanding larger context. If the answer to 4 and 5 is yes, I think then we are moving in the right direction. So I want to have no to the first three questions and yes to the fourth and fifth question. Then I think we probably in a better position to move in a direction where we consider mental health as a political. I used to teach, when I teach in social work, I say that social work is a political project. It's a political project, I'm talking about political party politics and all, but I'm talking about challenging the structures of oppression and engaging with structures, and at least in our understanding and analysis, if you're able to understand the challenges which exist as part of the structural oppression which exists in the society, then our engagement with communities, engagement with people, engagement with clients will be completely different. So I stop here. I know that I have overshot some time, but I stop here to have interactions. Thank you so much.
Hello, sir. Are we audible?
Yes, very much.
Thank you, sir, for the informative session and for the wonderful idea, structural competency of mental health professionals.
Hello, sir. Am I audible?
Yes, sure.
Sir, let us open the floor for question and answer session now. Okay, so we have audience from YouTube as well as WebEx, as well as the offline, the students in the seminar complex, you can raise your questions.
Yeah, I was saying that if any questions come in YouTube, if you could put it in the chat, I will be able to see that and respond.
Yes, sir. Yes, sir. Sir, we will be reading out the questions for you.
Yeah, sure. Oh, that's wonderful.
So we have got a couple of questions. Shall I read it to you, sir?
Yeah, sure.
First question, when we speak about attacking the core of the society, what kind of policy-related changes do you envision as important? Sir, I'm repeating the question. When we speak about attacking the core of the society, what kind of policy-related changes do you envision as important?
Okay. Are we going with a few more questions and
okay, according to your convenience, sir. Okay, can I read the rest of the questions? Okay.
Yeah, sure.
This question is by Sayant. This has been asked in the YouTube. Please share your views on the social life of the marginalized session. This message has been retracted right now.
Sorry, I didn't get that question clearly. Your voice is not clearly audible. Can speak a little louder?
Oh, sir, actually this was, we have got the question from YouTube, and right now the question has been taken back. So this is invalid. So we'll be going to the next question here. How can one tackle the vaccination inequality of at an international level, given the kind of budgetary healthcare expenditure you showed for low-income countries?
Yeah, right.
Another question, sir.
Yeah.
Especially in disability-related interventions, we usually take current and instantaneous soothing only than taking a lifespan approach, disability.
So can I go with my response?
Yes, sir.
Let me come to the first question, which is talking about, the question is about, I don't know whether I got it correctly, but attacking the core of society. What are the policy changes one would imagine? I understand that the person is trying to understand when COVID, situation is impacting or affecting the core of the society. Almost every aspect of life is being challenged. What kind of policy changes one can envision? What is that policy we would like to see in addressing some of these serious concerns? I would like to tell you that, see what we are seeing in a neoliberal society is that everything is being privatized, right? Everything is being privatized. If you go to US, I have my brother-in-law living in Boston. His wife had some, kind of test to be done. They could not do it in US. Despite paying for insurance, you cannot do it because they have to come to India because it has to be referred by some doctor. So they will not refer it because anything being referred is an expense on the insurance company, right? So they will not do it normally. They will wait. They will do all kind of you cannot even meet the doctor. So what is happening is that in this privatized kind of an environment, it is completely driven by market. The market will guide as to how to respond to. You may think that if you're having a good insurance scheme, you will be safe. Of course, it comes in at times when there is a huge amount of money to be shelled out for a treatment. But the insurance, conditions are such stringent that there are many sub clauses and fine prints which you will not be able to read. So essentially, insurance is a profit driven kind of a project. Now, why I'm saying this is that unless and until welfare and health education, some of these aspects are within the state domain with necessary budgetary allocations, you cannot have a situation where the private players, which is driven by profit, will deal with this. So that's why I told you about how the government of Kerala has been able to manage quite well in terms of the way the rollout of COVID responses was done, because the public health system is still very strong compared to other states. I'm not saying that that's the ideal kind of a situation, but compared to other states, other regions, the public health system is quite robust. The education system, when education and health and welfare, general welfare, are driven by the profit motive into the private sector, you cannot expect a response which is coming in. Now, for example, the informal sector I was talking about, when informal sector workers are being, not getting jobs, if it is a welfare oriented state which you have, what they will do is that they will provide for some benefits. Then some immediate relief can be provided. But when there is a completely market driven process, you will just leave it to them. They will have to manage on their own. There is no provision for giving interim relief. There are many countries, particularly the Scandinavian countries, when people were not able to go for work, they were provided benefits, benefits which will sustain them during this pandemic time, even though they are not going for work. So when the welfare state is completely collapsing, we are bound to see these kind of untoward situations coming at different points in time, is going to be hitting hard on the people. So my suggestion as a policy change is that social protection as a framework, if you don't know, I'm sure many of you might not be closely following the understanding of social protection. Social protection essentially means that protecting the people from vulnerabilities and marginalities becomes the responsibility of the state through various social security mechanisms. So social security and social protection as a state policy can only handle such kind of an issue where such disasters are hitting hard at the core of the human lives. The second, I don't know whether I'm satisfying the person who was asked the question, but that's my way of looking at things. So somebody is saying lack of access to quality education was a major problem during pandemic time. Absolutely, you're completely right in that. Could you please elaborate on impact in rural area of our country? Yes, so I've not done a study. I cannot say very clearly as to what could be what are the impacts, but from whatever I could see from my own eyes in many places and reading many reports of impact, I could see that one, the entire world has moved into an online education, and you know it very well that people who do not have necessary devices and internet connections and things like that, they are going to be hard hitting on this. Secondly, even in places where you do not have necessary situation to study in online, you need to have the screen, you need to have the mobile. There is only one mobile in the family and it is being used. There are 3 children studying and there is no other devices. They have to share. So all of these things are going to be, I think we are going to leave this behind for some time, this online business. But in rural area, the major issue has been lack of digital, what I wrote in my paper, which I was mentioning about digital poverty. A poverty which is caused by the digital. When the digital medium is mediating everything in terms of education, healthcare, welfare, and everything, and you are going to have, when you do not have access to the digital technology, you are leading to digital divide will lead to digital poverty. So these are some of the broad issues which I could see. Obviously, the mental health issues are much more significant, which doesn't get noticed, particularly in rural areas. And the second question about vaccine inequality, it's a very, very large, issue which none of us have any control on how to deal with it. But I think it becomes the responsibility of transnational institutions and structures such as UN and World Health Organizations to come in to bring some equitous vaccine policies, where the nations which have technologies, because when they were going for second and third doses and all, there are countries, particularly in sub-Saharan Africa, where not even the first dose was not rolled out to large number of people. More than 80% of the people do not have. So I think it has to be a global policy. When you have global structures in place, one needs to have such global policies which will ensure that the high-income countries must devolve certain amount of money and resources and technology to be given to poorer countries in such pandemic times. And if one part of the world is not safe, another part is definitely not safe. So one needs to understand this is a collective responsibility. And the third question is the lifespan approach. Is there an alternative? See, I think lifespan approach is definitely a useful tool for understanding disability and engaging with disability. But at the same time, I'm again coming back to the question that moving from disability to differently abled, where we need to understand that what are the strengths. It's not like, if somebody, I had a student who was, who was extremely talented in various ways, except that he cannot see. But he was an extremely talented person, and he was one of the top scorers in our institution. So we need to look at from a perspective, a strength perspective, when looking at disability. Lifespan approach will give you a kind of a possibility of looking at from a broader frame. But at the same time, that alone cannot be sufficient. I'm not suggesting any alternative, but in addition to the lifespan approach, one should also look at strength perspective to understand the issues of marginalized communities. I would also like to highlight that in my institution, I was the Dean of Student Affairs earlier. At that time, we did maybe the first in the country, we started a gender neutral hostel. We had quite a good number of students who are gender non-conforming students, who were not finding safe to either stay in the girls' hostel or a boys' hostel. We created a space called gender neutral hostel, first probably in the country. I don't know whether any other institution is having it. We started that gender neutral hostel. So create safe spaces, create inclusive atmosphere, create accessibility as a main idea for disability as well as for gender non-normative community. These are some of the ideas which should guide us to ensure that their concerns are well addressed. Any more questions?
Hi, sir. I have a question.
Yeah.
Somewhere towards the end of the presentation, you have mentioned that even we mental health professionals are biased in terms of maybe gender, caste, class, etc. And I was wondering to what extent the theoretical or the explanatory models we use to understand the phenomenology of a person is contributing to it. Because most of the time we depend upon the models developed from the developmental countries, like the cognitive behavior perspectives, or maybe even the humanistic perspective. And most of them are actually encouraging the client to maybe look into oneself, re-examine their thoughts, change the behaviors associated with disturbance. And none of them are telling us to look into a big frame to consider the social culture perspective. And I was wondering to what extent these explanatory and even the intervention models itself contribute to such biases.
Absolutely, absolutely. You're right. I think it's a hegemonic, you know, condition which is created by the so-called the colonization of knowledge, which quite often what happens is that this knowledge, which is Western, Anglo-centric, Eurocentric knowledge, which is considered as the knowledge. Students of psychology, is that we must engage in research which will produce knowledge, and structural determinants of mental health or structural determinants of human behavior need to be probably exposed much more and theorized. So we could have this broader structural framework, or maybe I use quite often this theory of structural violence. Structural violence is not something which is talking about a physical violence. If the structure in an educational institution is biased towards certain kind of identity groups, it is a structural violence. If a child dies of malnutrition, it is a structural violence. You cannot accept in a modern state a child dying of malnutrition. A mentally challenged person living on the street and getting abused is a structural violence. So we need to use some of those knowledge which is useful, but don't consume all the knowledge which is given as the final word on it. Your research, your engagement can actually bring in, say for example, when you're meeting a client, you must be able to have a bent of mind to understand the structural factors a person land up in your clinic. And that could be the way you need to explore. And then some of these, over a period of time, when you do practice for a few years, you must probably dedicate some time for analyzing this data. While you collect the case history of a client, you also collect information which will be useful for you to analyze, not to use it for any other purpose, but definitely when you are taking a case history, you are taking the consent of the person. But you analyze his profile and try and understand what are the structural determinants of the problem which you are confronted with. Or you start a study. I'm sure most of your master's program will have a master's dissertation. Try and look at some of these aspects beyond using the tools and scales and things like that, which are developed elsewhere, probably adapted to the cultural context where you are looking at, but you are still using those scales. Along with the using of the scales, you also engage in some qualitative, probably methods to understand the life experience of the person, of the people. So try and explore those possibilities. So that's the only way we can try and build knowledge. The creation of knowledge is going to be the key, because we need to challenge the coloniality of knowledge and power which exists in almost all disciplines. Unless and until we are able to do that, we will continue to be the consumers of the so-called Western knowledge.
Sir, we haven't received any further questions. So we would like to thank you for this wonderful session.
Yeah, thank you so much.
Sir,
there is something,
me, sir.
trans and caste politics are often excluded topic when it comes to mental health discussions among professionals. So yeah, wonderful. I think you need to consider some of these ideas in your classrooms and in your engagements. Thank you so much for accommodating my probably somewhat probably objectionable or maybe somewhat offensive comments about our own professions, in which I am including myself into this fraternity of social work, social engagements. Thank you so much.
Hello, sir.
Yeah.
Sorry, but I just have a last question to you. So you spoke about different perspectives towards mental health, like all the existing perspectives you were mentioning. But sir, if you actually posed a question to us, asking whether the existing perspectives are good enough to explain the present scenario and all. So what would be a new perspective, like, from your understanding, your researches and your reading? What would that new perspective or something that can better explain the existing scenario? Can you think of something of that kind? Maybe for us to get a different idea, like, to think from a different lens.
Absolutely. See, I think it is good to read a report by Mariwala Foundation. I think there is a report called Reframe. If you read that document, it talks about a structural perspective. So, structural determinants of mental health. This is something which I am trying to propose. I'm not saying it's a perspective, but it's the structural factors contributing to mental health is something which we need to explore further. There are a whole lot of work related to structural determinants of mental health. So I would suggest that we talked about cultural competencies. Develop structural competencies. Structural competency which will include a critical analysis of structural factors which contribute and which produce and reproduce mental health concerns. So I think I'm not proposing a new kind of a perspective, but at least a lens to look at, a socio-political lens to look at mental health issues through a structural perspective is something which I am proposing. And there is quite a few good research, and I mentioned about this document. If you search on the net, you will get it. Reframe, which is by Mariwala Foundation. So I could, maybe I could send some of the details, maybe the document to the team there. You can share it among yourselves.
Thank you, sir. Your session was a reminder to look into the structural injustice as a mental health professional. Thus, question and answer session comes to an end. For the participants to note, we'll be providing a feedback form in the WhatsApp group. Please check in and submit the feedback form. Thank you.
Okay, thank you so much. I'll sign off, and all the very best for the conference, and it's a wonderful opportunity, and it's a good way of connecting with the contemporary challenges which confront mental health as well as psychology discipline. Thank you so much.
Well, it's almost time for lunch. Enjoy your meals and please be back here at 1:30 p.m. for the afternoon sessions. The first session will be symposium titled Youth and Their World During the Pandemic, and the final session will be invited talk by Dr. Kirti Pai.